Welcome back to Autism Demystified. I am Dr. Vladimir Barayev, general pediatrician specializing in autism for children and developmental care as well. And today we have a very special guest who is joining us. It is not Valentine's Day, but we have a heart doctor here with us today, Dr. Robert Spencer. I am going to open up a document and read his bio, and then I'll have him introduce himself as well. So here we go. Dr. Robert Spencer is a pediatric cardiologist at Staten Island University Hospital, where he provides comprehensive care for children with congenital and acquired heart conditions. He earned his medical degree from NYU Langone School of Medicine, followed by a pediatric residency at Mount Sinai Hospital and a pediatric cardiology fellowship at Columbia. He sees patients at 900 South Avenue and is also actively involved in medical education and research. Dr. Robert Spencer, welcome to the show.
Thanks for having me, and hi, Dr. Vlad, and thanks. It's really an honor to be here. I love watching your podcast, and I'm excited to talk with your audience.
Well, we are very lucky to have you today. I want to start out by asking you to please introduce yourself and your role as a pediatric cardiologist so that people understand exactly what you do and how you serve the community.
Yeah, absolutely. So as you said, I'm a pediatric cardiologist. That means I specialize in children's hearts. A lot of what we do is make diagnoses before birth, so fetal diagnoses. We do fetal echocardiograms. A lot of congenital defects is what I pick up. So we're talking about like small holes in the heart, valve problems, stuff like that. And as kids get older, sometimes there are acquired heart conditions, which we also diagnose and treat. And as you mentioned, I see patients at Northwell Health at 900 South Avenue in Staten Island.
Wow, that's great. Thank you very much. There is one very interesting question that I wanted to ask you, unrelated completely to your professional life and your work, and that is your personal interest in typewriters. How did that begin, and what is it that is so fascinating to you about typewriters?
Yeah, that's a really good question. I'm glad you started with that. I fell in love with typewriters when I was in fellowship. It was actually in the middle of COVID, and I remember that I was just like looking for something to watch after work one day, and I came across this documentary called California Typewriter on Amazon Prime, and it was a documentary, of course, about typewriters, and I just fell in love with them. After watching the documentary, you ever get that urge to like, I need one of those. I need to buy one of those. I found one on Craigslist. Was the most sketchy transaction I could possibly imagine, meeting someone and just buying a $20 typewriter from them. And I just fell in love with it. It was such a cool thing. Typewriters have the special way of, they're so mechanical, they're so analog, you're completely disconnected. And I just love that. And I find myself being more productive when I'm sitting in front of a typewriter. I use them for notes. I use them to write letters to people. I love the clicks and the clacks. I just love typewriters. And I have gone through about probably 100 of them. I like to buy them, sell them, repair them. So it's a true hobby. Yeah.
Wow, that's amazing. So it's that tactile, that close interaction with the work that you're producing, with the writing you're doing. It's very different from the depersonalized typing that we have these days with modern computers, and even with tablets or phones, how we type away on our screens. It feels like very not satisfying to write in that. And also, I felt the same way. I don't really find myself to be inspired or very creative when I'm using computers to write. Like handwriting things, I'm much more likely to come up with like very interesting ideas on what's really on my mind.
Exactly. And it's interesting. Your work productivity really changes because you don't, like when you're writing a document on Word, you have all these red squiggles and you're constantly editing yourself, and you just don't have that with a manual typewriter. It also is a lot less forgiving in terms of making mistakes. When you're working at a keyboard, you can just delete, but on a typewriter, you're Xing it out. And I should just tell everyone, my son is in the office, so if you hear a 4-year-old suddenly start talking, my son is off from school today, so he's coming to work with me.
Yeah, I'm in the same boat, brother. You might hear my kids screaming at any point during our recording.
100%.
So, all right. So, um, let us begin with how cardiac conditions interact with children with special needs, with autism and ADHD, starting with um, heart, the effects on the heart, the possible effects on the heart for medications that we use to manage ADHD, stimulant medications and non-stimulants.
Yeah, so great question. To take a step back, like there are a few different ways that autism and ADHD and neurodevelopmental issues that they intersect with cardiology. And the first is that children who have these conditions, who are on the spectrum, who are neurodivergent, they have a higher risk of congenital heart disease and vice versa. Some of that is genetic, and some of it we don't really totally understand. So that's number one. So children who are neurodivergent have a higher risk of having congenital heart defects, and children who are born with heart defects have a higher risk of being neurodivergent. That said, the second thing is children who are neurodivergent have a higher risk of autonomic dysfunction. So problems in terms of regulating heart rate and blood pressure. That's number two. And the number three way I would say that they intersect is, like you just said, there are medications that that children who have ADHD or autism that they tend to be prescribed, and those medications can definitely have cardiac side effects. And a perfect example is stimulants for ADHD, which tend to increase your heart rate and blood pressure. And then also antipsychotics such as risperidone that can have similar kinds of effects, and they can lead to certain EKG changes that can be dangerous in some patients.
Okay, so does that mean that every child who is going to be started on a medication for ADHD needs to have an EKG done or needs to see a cardiologist beforehand?
That's also a really good question. The answer is no. So based on the American Academy of Pediatrics and other organizations, this is all like a risk benefit kind of thing. And the risk is low enough that children who don't have any kind of concerning history or exam findings, they don't require EKG screening or surveillance. That said, children who are on certain medications that can increase your heart rate and blood pressure should be monitored occasionally by the pediatrician, by the neuropsychologist, just to make sure that their vital signs are not having changes that are concerning, that their heart rate is not going too high or blood pressure. But in terms of seeing a cardiologist and EKG screening, I would say the main indications for that are if, one, they have a history of symptoms, two, there are certain exam findings, such as a murmur. Three is if there's a suspicion of an underlying genetic abnormality. Those are the main ones. And I guess the fourth one would be if there's a family, certainly if there's a family history of early or sudden cardiac death or anything like that.
Can you go into a little bit more detail about the family history of cardiac disease? When we say family history, are we talking about first-degree relatives like parents and siblings, or a grandparent, or an uncle or aunt or cousin who may have had a heart murmur? Like, how do we clarify for parents what it is to have a positive, significant family history of heart disease?
Yeah, good question. So first-degree relative being like a sibling or a parent, that would impart the highest risk. So if, for example, mom or dad passed away when they were in their 20s or something like that from an unexplained cause, then that is very concerning. And certainly that child should have a screening EKG and really, frankly, should see a cardiologist just to make sure there's nothing that could have been passed forward and, that there was a cause of that sudden death. If it's a second-degree relative, such as like a grandparent, then the risk is a little bit lower, but that child should still be screened. And similarly, to describe sort of like what the conditions would be, the biggest concern is if there is an early risk, death that occurred, or sudden cardiac arrest, or a pacemaker, or a defibrillator was placed. If any of the above happened in a first or really a second-degree relative as well, that warrants a cardiac evaluation in the child. If there was a family history of congenital heart defects, like a structural problem, so for example, like bicuspid aortic valve. Aortic valve is the big doorway that takes blood for that basically separates the left-sided pumping chamber from the big blood vessel called the aorta that takes blood to the body. If that's an abnormal valve, then that can run in families, and that warrants investigation for the child. If there's any other like major valve problem, if there's any history of like holes in the heart, things like that, or like a thick heart, stuff like that, then the child should be screened.
Okay. So that means that significant structural heart conditions or abnormal rhythms and such. Now, what about as far as you mentioned symptoms? What specific symptoms are children going to exhibit when they have heart conditions?
So the ones that we always look for and talk about are things like chest pain or palpitations, which is when you feel like your heart's not doing the right thing. It's beating funny, it's beating fast, it's beating slow, it's beating differently, extra beats, passing out, feeling really lightheaded or dizzy. Those are the main symptoms. But one thing to keep in mind is that children who have autism tend to or can express those symptoms differently. So they may not be able to necessarily recognize those are palpitations, that their heart's beating kind of funny, or express it. And same with discomfort. It may manifest as something like, fussiness or a tantrum or something different than just kind of telling a parent that their chest hurts.
Okay, I see. Now, a lot of families seem to have this concept confused. So I'm very happy to have a heart doctor here to clarify it for everyone, including myself, because I love to hear these explanations all the time. I'll always love to learn. Families say that, oh, my child does have a heart condition. They have a heart murmur. And how do you explain to families the difference between a murmur and actual heart disease?
Yeah, so I start by examining and taking a history and finding out more information. But heart murmurs, or what a heart murmur is really just a sound that you hear when you take your stethoscope. It's not something we see necessarily. You can't really see a murmur. You hear a murmur. That's when we use our stethoscope, that's what we're really listening for. So usually we would hear like a bump, 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 bump. And in addition, those are the heart sounds. And in addition to that, sometimes we hear something like a shh, shh. And that's what a murmur is. It's an extra sound. 70 to 80% of children have a murmur at some point in their lives. And it can be a normal thing. It could be a normal variant. It could be the sound of blood flowing normally in the heart. And when that's the case, when the echocardiogram shows that there's no structural abnormality and it sounds like an innocent murmur, and by that I mean a murmur that is in a certain part of the heart cycle and it's soft and it's not very loud, and there's certain things we listen for. The way that I describe it to parents is that it's almost like if you take a cup and you listen really, really carefully, closely to the wall. Sometimes you can hear water inside the pipes, but nothing is wrong with the pipes. And it's the same concept. You're listening really closely to the heart, and sometimes you can hear blood flowing in the heart, but nothing is wrong with the heart. Now, that said, sometimes a structural abnormality, for example, a small hole in the heart, can cause a murmur, and that's what we're looking for and making sure that it's not something like that. That's a little bit different. Then you're actually perhaps hearing blood flow across the hole, something like that, and that could be an indication just that there is an actual problem. So we get a lot of referrals from pediatricians for murmurs. We do testing and listen, and then if necessary, we do an echocardiogram, and we make sure that there's nothing structural that accounts for that. It's causing that murmur. And if that's the case, and it sounds like a benign murmur, then I give a lot of reassurance.
Okay. Now, going back to the subject of neurodivergent children who have autism and may have some behavioral challenges.
Yep.
Can you talk about the challenges that it comes to doing a visit with a cardiologist or an assessment for a neurodivergent child in the office?
Yeah, that's a great question. So it sort of, I think that children who are neurodivergent, we rely a little bit more heavily on mom and dad and the parents or guardians account of what brings them here. You know, so if there are symptoms, I want to hear how they express it. You know, what the parents' sort of impression of it is. I want to find out more information, and their history, that history from the parents becomes, or guardian, becomes more important to me. Because it's a little bit more difficult sometimes for children who have these conditions to communicate to the doctor what's going on. As far as the testing itself goes, I've noticed that children who are neurodivergent can have sensory issues. We try to do certain things like make sure that the room is really quiet, dim the lights, try to prevent that sensory overload. That's a major thing. A lot of what it is also being patient and trying to sort of prepare the patient for like what's about to happen. You know, that can be showing them the transducer, and which is like the probe that we use, and sort of showing them what's about to happen. So it's a lot of preparation and you know, sometimes like storytelling to them. We do everything we can to distract. Sometimes we play soft music, relaxing music. I also try to find out from mom and dad or guardian like what they like, you know, what's a good distraction for them. We have a child who's neurodivergent who loves watches, and so I have a watch like ready to go for that patient. Those are some of the tricks that we have, and just generally some of the things that we do to accommodate these patients. Yeah.
Oh, that's incredible. That's very kind of, actually, you just reminded me. I would love to start creating a database on perhaps my website or somewhere for families, for something for free to access of like social stories of like, here's what they're gonna see in the dentist's office, here's what they're gonna see when they visit the cardiologist, and like put all that together to give families something, because making social stories is not always that quick and easy, and you kind of need it ready to go when you're before a child's appointment, so they don't forget what the story was in advance.
100%. Yeah.
Okay. What final messages would you like to leave our listeners with? You've given us so much valuable platinum, diamond, and gold information already. What is a key message that you want our listeners to take away today?
I think the main message here is that children who are neurodivergent can absolutely receive like the best possible care. They can receive excellent care. You know, the things that parents can do to, or guardians, to set their child up for that is to communicate effectively with the physician and with the staff. Things that will make it easier for the child. You know, certain things that we can tailor the visit to their needs. And just generally to sort of like champion for them and you know, help us make this visit as comfortable as possible. But those are the takeaways, and you know, just in general, to check in with the pediatrician, see if a cardiac evaluation is warranted, if medications are started that have cardiac side effects, heart side effects, then, you know, just make sure they're getting the right follow-up and surveillance. And that doesn't always mean they need to see a cardiologist, but just to kind of make sure that the heart rate and blood pressure are in check, that they're not having any symptoms. So those are the main takeaways here.
All right, that's great. And before we wrap up, actually, there was one other topic that you kind of brought it up before when you mentioned risperidone, which is how do we help protect the heart when there are some kids are on medications which are known to cause weight gain, to cause metabolic syndrome.
Yeah.
How do we proactively prepare families for that?
That is also a fantastic question. So
only the best questions here.
Yeah. To take a step back, children who have autism and ADHD, we know they have a higher risk of metabolic syndrome. We know they have a higher risk of obesity and mental health disorders. So that's like problem number one. And even aside from risperidone and medications that can cause these problems and amplify these issues, I would say for all children, it's really important to make sure they're living healthy lifestyles, to make sure they're eating right, drinking right, getting enough sleep, depending on their age, at least like 8 to 10 hours, at least. Exercising. Children who have autism also need exercise. It's even more important, perhaps. And so that's at least like an hour a day of some exercise. And so I would say the same thing is true for children who are on risperidone, where that's also increasing the same risks of obesity and metabolic syndrome. They also, for the same reasons, require those kinds of kind of preventive care, healthy lifestyle. So I would say that's number one. That's the most important thing that parents can do to set their child up for success, is make sure that everything that is modifiable, that you're doing the right things and helping the child, stay healthy.
Got it. So the fruits and the vegetables are still important. Being physically active on a consistent basis is still important. Not just saying, oh, my kid runs around here and there. No. Are you guys walking outside as a family, as a unit, making sure that it's a consistent thing on a schedule? Because the key is the consistency of it all. That if you're not doing it consistently, it's like you're not doing it at all.
Totally.
So, Dr. Rob Spencer, where can our guests find you and your wonderful services?
Yeah, so I'm at 900 South Avenue. That's in Staten Island. Our telephone number here is 718-226-5619. 718-226-5619. And I'm happy to give my cell phone out too. I do it to families, families who are here. So if anyone, needs help, my cell phone is 646-334-8057. And again, that's 646-334-8057.
That was very generous of you. You're a kind human being and a wonderful physician. I have had the luxury and the pleasure of working with you closely for my own families, and I cannot more highly recommend specialists such as yourself. I thank you so much. I'll make sure that a link to your website and your social media and your address and your phone number are all in the show notes for this episode. Dr. Spencer, thank you so much for joining us today.
Thank you, Dr. Vlad. And again, it's really an honor to be here, and I'm such a fan of you. So feelings are all mutual.
Thank you so much. So, families in New York State, navigate autism with confidence. If you are looking for a pediatrician who will help you guide your child's unique developmental journey, you can please contact my office at 917-819-5056. Once again, it's 917-819-5056. We have staff available 24 hours a day, 7 days a week to answer your phone calls. And everyone,